There are places in the world where contralateral prophylactic mastectomy or double mastectomy has nearly tripled over the last 20 years. Is this aggressive approach the best mode of treatment for early breast cancer? Or are women shortchanging themselves of better cure rates? Let's find out. So what does global evidence show? Which type of surgical treatment results in better cure rates for early-stage breast cancer? As we have done in the other videos in this series, we scrutinize world medical literature to discover how better breast cancer cure rates were achieved through surgical treatment choices. Here are 3 more countries which have reported better breast cancer cure rates based on the type of surgical procedure. Let's begin our journey. In a prior series of videos, we have discussed how and why the National Institute of Health published this consensus statement in 1991. The list of videos is provided here as well as in the description below. For now, we will focus on the fact that this professional medical body, back in 1991, stated that breast conservation treatment is preferable to mastectomy because it provides survival rates equivalent to those of total mastectomy while preserving the breast. Since then, there are multiple reports from different countries that breast conservation treatment results in superior survival outcomes or cure rates when compared with mastectomy. Let us look at 3 of these studies. This is one of the first large registry-based studies in North America to report improved disease-specific survival, or DSS, with breast conservation treatment. Disease-specific survival reflects the cure rates for breast cancer therapy. This group of researchers from Duke University Comprehensive Cancer Center in the United States evaluated 112,154 women and their outcomes after breast cancer surgical treatment. As we have seen in our other videos, these are survival curves which provide survival or cure estimates of the patients in the study. The y-axis of these charts represents the proportion of women still alive, while the x-axis represents the number of months which have elapsed since treatment. It is expected that the curves would slope gently downwards toward the right of the charts. By drawing 2 curves on the same chart, we are able to compare the survival or cure rates for the different types of surgical treatment. You would have already seen that lumpectomy is used interchangeably with breast conservation surgery with radiotherapy. The combination of breast conservation surgery and radiotherapy is referred to as breast conservation treatment, or BCT. It is clear that more women who underwent BCT are still alive at 250 months, or more than 20 years after treatment, compared with those who underwent mastectomy. This team of doctors mentioned that they had observed the unanticipated finding of patients treated with mastectomy having a significantly lower overall survival and breast cancer-specific survival than women who underwent breast conservation treatment, or BCT, even after statistically adjusting for tumor grade and proportion of involved lymph nodes. This underscores an important principle of research. Results of a study may be counterintuitive, and this is the reason we need continuous research to ensure patients are receiving the best treatment outcomes. I appeal to women with early-stage breast cancer not to shortchange themselves of better survival and to make the right surgical treatment decision which helps them live longer. We move from North America to Asia, where a group of Chinese doctors compared the treatment outcomes of breast-conserving surgery plus radiotherapy versus mastectomy for patients with stage 1 breast cancer. Of the 6,137 women who were included in this study, the women who underwent breast conservation surgery with radiotherapy enjoyed significantly greater 5-year survival compared with the mastectomy group. Therefore, their recommendation was that since breast conservation surgery with radiotherapy provided better outcomes than mastectomy for eligible patients with stage 1 breast cancer, BCT should be offered as a preferred treatment option. Here is a study from Sweden with a large patient cohort. You may wish to pause the video at this point to review the details of the key points. In brief, the research team found that breast conservation seems to offer a survival benefit and should be given priority if both breast conservation and mastectomy are valid options. Please note that this is solely an educational video and not intended to replace a surgical consult. Do consult your doctor if you wish to know whether both breast conservation and mastectomy are valid options in your specific circumstances. Here we see a few more survival curves from the Swedish study comparing breast conservation surgery with radiotherapy, abbreviated as BCS plus RT, represented by the dark curve, mastectomy without radiotherapy indicated by the blue curve, and mastectomy with radiotherapy indicated by the yellow curve. We can see that the highest survival was achieved with breast conservation treatment comprising breast-conserving surgery and radiotherapy. Mastectomy, with or without radiotherapy, resulted in poorer survival or cure rates. In their final assessment, Dr. de Boniface and her team found that breast conservation surgery with radiotherapy yielded better survival than mastectomy. May I therefore urge women with early breast cancer to heed the evidence published from multiple centers and not to shortchange themselves when making a decision regarding the surgical treatment of breast cancer. We have discussed several studies which demonstrate better survival or cure rates with breast conservation treatment. To answer the question about bilateral or double mastectomy posed at the beginning of the video, we present work by Dr. O'Keefe and his team. In this study, bilateral mastectomy was associated with significantly increased risk of breast cancer mortality relative to lumpectomy with radiation for tumors with certain characteristics. This translates to bilateral mastectomy resulting in poorer cure rates compared with BCT. For more information on contralateral prophylactic mastectomy or double mastectomy, please view our playlist on the subject. Multiple studies report that the majority of women will benefit from breast conservation treatment. Improved survival or cure rates have been demonstrated from many countries across the world. We trust that this information will help women make surgical treatment decisions which help them achieve better cure rates and live longer. Global data supports an increase in the use of breast conservation treatment. If this is achieved alongside a reversal in the rising trend of contralateral prophylactic mastectomy or double mastectomy, there is hope of improved breast cancer survival rates worldwide. That is our aim in producing these information videos. See you in the next video.